Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines, and our lone U.S. COVID statistic through today, August 15th. We invite you to submit any questions or suggested topics you have down below in the comments via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with our abbreviated COVID statistic, average COVID deaths per day in the last reported week were 73 daily. In the same week in 2023, we saw 79 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the general status of COVID in the country?
Well, the numbers are about the same as last year, so we don't see much of a difference. If you take 73 people per day per year, that's 26,645 people. Now, we know that these numbers go up and down, but we're at a very high level. If you look at the wastewater surveillance program, which just gives a general idea how much COVID is in the community, it's very high. And this is the second week in a row the United States is at the very high level. So there's a lot of COVID floating around. So we're having, hopefully coming towards the end of this summer wave, but we're probably at the peak right now. It's unlikely to continue to go up as the summer begins to sort of wane. The same Omicron variants, KP.3.11 and KP.3. Nothing really is changing, but the family of viruses remains the same. The vaccine that's coming out in September is geared towards these Omicron variants. So it should work a lot better if you're eligible to take another vaccine, which you can take at the same time as you take your flu shot, which if you actually take it on the same day, the COVID vaccine works even better. So that's what's happening right now.
Yes, and we'll, of course, be sharing as soon as those vaccines become available. But sticking with COVID and going into our first submitted question of the day, we have a viewer who asked, can you talk a little bit about the demographics of who is most severely affected or dying from COVID currently? Is it by age or is it more vaccination, a little bit of both? Please break it down for us.
Yeah, so, we stopped really following this a year ago. So we have sporadic reports, and then we have reports from other countries that still report this. But what we're seeing is the last in the United States that it was really looked at closely was a year ago, September, where 2,800 people died from COVID. Of those, 90% were 65 years or older. So really predominantly in the older age group. If you look back further into the pandemic, you look in 2020 or before that, September 2023, 93% of all the COVID deaths, about the same amount, occurred in people over 50. So the whole mortality rate has shifted up into the older age brackets as there's more and more immunity in the community. If you drill down even deeper, the largest portion of the deaths are in those 85 years and older. So the real elderly, nursing home residents and people living at home, their immune systems are more frail and they are at higher risk. But no matter how you slice it, the vaccinated people, particularly the vaccinated with a booster, and you can break it down to 1 booster, 2 boosters, 3 boosters, the more vaccines you've had, even the lower your death rate is. So it's 2 things, age and vaccination status.
And at the height of the COVID pandemic, way back when we were in our worst of the worst part of the process, can you give us a little info about what those disparities looked like in terms of COVID vaccinated versus non-vaccinated people?
Yeah, this is a good, very good point you're bringing up. Because prior to, if you look back to January 2022, the unvaccinated death rate was 33 per 100,000, right? Whereas if you had the vaccinations, it was only 3 per 100,000. So it was only 1%. I mean, the response was so dramatic. Now, as people get more immune, they've had COVID multiple times, they've had multiple vaccines, whatever, those numbers have come down dramatically. So the unvaccinated death rate now, or at least in August of a year ago, was 0.6 per 100,000 in the unvaccinated, compared to 0.14 in the vaccinated people. So that's 4 times higher. That's the way to look at it. But the overall number is remarkably lower. And so this is all about herd immunity, which is a combination of vaccines delivered and number of COVID cases. And we've just had just an enormous amount of COVID cases just in this summer wave, and we had a big jump also in the winter.
Mhm. Our
Yes.
next question sticks with COVID and is specifically about the vaccines. This viewer is a big believer in the vaccines and they are up to date with their vaccinations at this point. However, they have been getting a little bit nervous about the next one, as a young woman they know in their 40s received a COVID vaccine, had a headache, and unfortunately passed away from a brain bleed the next day. They understand it could be a coincidence, but given the close timing, she was wondering if there's any empirical evidence or studies showing that a COVID vaccine can be linked to a brain bleed.
Vaccines have, some of them have potential for a severe side effect. And this could be a side effect of the vaccine, or it could have aggravated an underlying condition that existed already. People do have bursted aneurysms in the brain, and this does happen in the population. This kind of connection with the vaccine dose, I mean, it's very suspicious. So, I mean, it could be. But let's take a look at how often this happens. Since the pandemic, there have been 10 identified cases of intracranial hemorrhage, that's brain bleeding, after receiving the Pfizer vaccine. 10. Now, in the United States alone, there have been over 700 million doses of vaccine given, but that's Pfizer and Moderna and J&J. J&J had the higher side effect rate. And in the world, as of 2022, there were 12.7 billion doses given, and probably well over 15 billion doses have been given, in the last 2 years, I mean, total. So you looked in Japan, where they have good centralized record reporting. They thought that there was a possible relationship, and of the patients who died there, another 10 patients, most of them had underlying cardiovascular conditions like high blood pressure or family history or hypothyroidism or something. They had other medical conditions which may have contributed. But it's real. No one's trying to hide this up. This is the facts. But keep in mind, any vaccine can do this. Vaccines stimulate this immunologic response. The immunologic response can trigger all sorts of stuff. Guillain-Barré syndrome, all these neurologic things, brain bleeding and whatever. But it's in the single or low double digits after hundreds of millions or billions of doses. So you would have to throw in all the vaccines out there and say that they all have a potential risk for something happening. if we don't take any vaccines, the mortality rate for every infectious disease is going to skyrocket. So it's always a risk-benefit ratio. And right now, if you're eligible to take the new vaccine in the fall, you should take it because your risk of dying from COVID, complication of COVID, or getting long COVID and have the problems associated with that are much higher. So it's a decision you have to make, but you have to really put it in perspective. There's nothing out there that you do that's 100% safe. Like, you wear your seatbelt, right? There's laws that mandate that, by the way, but you can still die in a car crash. But that doesn't mean that the seatbelt didn't work. So it's the same kind of thinking. We have to, put that really into perspective because it can happen with everything. We talked last week a little bit about, the impact of the vaccines and the hundreds of millions of people that have been saved by vaccines. Measles and diphtheria, all the other vaccines we have, cervical cancer in women, all that can be prevented by these vaccines. So, you save hundreds of millions of lives. You, unfortunately, in that process, there are people that will suffer consequences, and they're associated, probably related, but, they're a very, very small number, relatively speaking, to how many of these vaccines are given. Hundreds of millions, billions.
Yeah. Very unfortunate. We're very sorry for your loss.
Yes.
Obviously, I'm not a doctor, but knowing nothing about the patient's medical history, other conditions they may have had underlying it, and not seeing them yourself, it's really impossible to know if this was a case of the COVID vaccine or not. But we have another question regarding COVID, this time about the Olympics. Sure, we all watched at least some of the Olympics, but there were several athletes who ended up testing positive for COVID and were able to still participate in their events. Is the variant less dangerous? What does this mean for further spread and possible mutations? And why were they allowed to compete if they had COVID?
Well, it's a sign of the times. The Olympics, the whole situation, you have, hundreds and thousands of Olympians living in the Olympic Village, very crowded, sometimes two to a room, packed metros and, crowded locker rooms and, contact sports and, being around masses of people from multiple countries. I mean, it's the picture perfect way to spread a respiratory illness. They decided, though, that they're not going to, if you get COVID, you do what you want. I think the biggest risk for these young, otherwise very healthy people, the biggest issue for them is that, of course, if you get COVID, you're not going to be able to compete at the Olympic level. You're going to have to drop out, and several of the Olympians had to drop out. What if a whole team gets COVID because it's so contagious? The whole team can get wiped out. So it's just kind of a common sense thing. These are not people at high risk for dying from COVID, but they're still going to get sick, and of course they can spread it to other people. So, but it is, there is absolutely no attempt to control for COVID or enforce anything. And as if you saw the Olympics, there were players that had COVID, so it is, there's really no rules. It's all left up to the individual teams, how they want to handle it. But it's really looked at more as a nuisance. But remember that this is a population that's very young and otherwise very healthy.
Mm-hmm. Absolutely. Like you said, it was kind of left up to the teams. There were athletes that, tested positive and went home. I know there was a German athlete specifically listed, but yeah, there was a lot of people competing with COVID. So I guess we'll wait to see the effects of that. Mm-hmm. Now, our final submitted question for the day comes from another viewer. Is the RSV vaccination a one and done shot? They received theirs last year and are wondering if they'll need to get another one.
This is a great question. As of today, it's a one-shot deal. Now, that could change over time as they follow these patients out and look at the levels of their antibody. But for some reason, this RSV vaccine, one shot seems to do it for at least a year or two. Now, remember, why are we doing this? We're doing this because RSV, respiratory syncytial virus, causes 177,000 hospitalizations per year and 14,000 deaths. So that's in young children under a year of age and older people. So there is a vaccine. It's highly effective. They have just changed recently in the last couple of months the recommendations for RSV vaccine to everybody who is 75 and older, or 60 to 74 if they have some underlying disease, lung disease, heart disease, some kind of debilitating disease, or over 18 years of age who are really immunocompromised. People with cancer and have an organ transplant, really immunocompromised. They also recommended, at least the Pfizer one, for pregnant women in the third trimester. Now, this has nothing to do with the mother, but the mother will produce the antibodies that will protect the baby in the first year. And babies, especially under 8 months, are very much at risk and result in a lot of hospitalizations and deaths if they are not treated. Now, the kids can take this monoclonal antibody, and it's highly recommended, but last year they didn't have enough antibody around. People couldn't get it. It's more expensive. So another option is for the mother to, there's plenty of the vaccine doses available. So the mother could take the vaccine. It's been shown to be safe. Nobody really had any significant side effects in the pregnant women that were tested. So that's RSV really in a nutshell. So it's basically, to answer the question simply, right now, one shot will do it. You don't have to take it, and don't think about taking any more.
Mhm. And our first big headline of the day. Yesterday, there was a massive announcement regarding an outbreak that we have been following for many months now. Can you please tell us what that is and what's happening?
Yeah, so we mentioned last week, for those who are following us here, that the overall worldwide response to the ongoing outbreak of Mpox in Africa, particularly in the Democratic Republic of the Congo, or Congo, that the cases are increasing there, and basically nobody's doing anything. I mean, it's just pathetic. So what has happened there? Why was there this concern? Mpox cases are up 160% year to date, with deaths increasing by 19%. The clade 1 Mpox, which is the African version of Mpox, affects mostly children, has resulted in 14,000 cases and 524 deaths in Congo alone, which is 96% of all the global cases. However, 12 other African countries are now reporting Mpox. So it's spreading. It's spreading around the continent. They're having cases in South Africa. If you know the geography of Africa, South Africa is very far from Congo. They're having cases in West Africa. They're having cases in East Africa. So it is spreading around. And the mortality rate appears for clade 1 be somewhere between 3 and 4%. And again, it's mostly in children younger than 15, which account for 85% of all the deaths. The clade 2 was the kind that is affecting adults, primarily men who have sex with other men. That's been going on for 2 years. There is a treatment. There are vaccines. It's related to the smallpox virus. So smallpox vaccines work, but they have other vaccines more specific for Mpox. And only about 20, and the vaccine has been offered for over a year, and only 25% of people in the United States, anyway, who are at risk have even bothered to take it. So the vaccine uptake is very low. Now, In Africa, where they're actually having even more deaths and more problems in these kids, there's like no vaccine. So that was the status a week ago. So what happened in the last week is the WHO declared it a global health emergency. So what does that do? From a policy standpoint, it opens the doors for other stakeholders to jump in and provide some relief, either in the terms of buying or donating vaccines or supporting organizations that are implementing the vaccinations in the countries impacted. So that's really good, and it does open up even more funding to attack this thing. Why are we doing that? Well, we already had this other outbreak, which included many thousands and thousands of people, way more than 14,000. But that one was not so lethal. It was less than 1% dying. But still, I mean, a rash that can kill you in certain situations. So anyway, this is good because we've shown with every other one of these diseases that they can be worldwide. They don't respect any political borders. Who knows? Maybe it will be more contagious than the last one if it does get out into the more general population or throughout the continent of Africa. So it's a very good sign. It's finally done. It was bound to happen, and hopefully this is going to start to turn things around.
Mm-hmm. And I mean, health authorities have been spread so thin. It's summertime. Mpox is not the only infectious disease that is traveling around the continent of Africa, like we have in the US here. There's COVID, there's mosquitoes, there's this, there's that. So the strain on the health system has been immense. And like you said, opening up the doors for funding, donors, all this help is really going to be great.
Yeah.
But our final story for today, recalls on food products happen more often than we would like, any consumer would like. But I understand that there's been a very serious outbreak linked to deli meats. Can you tell us what bacteria is causing this outbreak and how it's affected the public?
Yeah, this was reported just a couple of weeks ago, an outbreak of Listeria. It's a bacteria that's linked to deli meats that are sliced at the counter. 43 individuals have been hospitalized so far. 3 have died, including 1 in Illinois, where we are, 1 in New Jersey, 1 in Virginia. And the outbreak was linked to sliced deli meats from Boar's Head. That's a brand name. And they recalled certain ham, turkey, and liverwurst products on July 26th. And by July 30th, they recalled all their deli products. And they were looking especially for codes that said EST 12612 or P 12612 on the labeling or whatever. But this one company is the source of these most of these infections in the United States. Keep in mind that Listeria has very kind of vague symptoms associated with it: headache, stiff neck, confusion, loss of balance. It can lead to convulsions, but fever, muscle aches. It's like any kind of flu type thing. Those 65 and older are people with weakened immune systems are at the highest risk, and pregnant women are also at high risk. They can lose the pregnancy, and they're also high risk for getting infected. So it's just people should be aware of this and the deli meat situation. It's also been reported in the past in unpasteurized milk products. So always be careful of unpasteurized milk. There's a good reason to pasteurize milk, by the way. That's the story with Listeria. We also have a story on avian flu too. The U.S. is finally expanding the testing of beef in slaughterhouses. Now, on Tuesday, just 2 days ago, the U.S. Department of Agriculture announced it will be expanding H5N1, which is avian flu, testing to beef entering the U.S. food supply in response to outbreaks of avian flu in dairy cattle across the country. So in other words, after a while, they ship the cows off to be slaughtered. So now they'll be testing those cows. So, they've done some very minimal testing. They tested 200 dairy herds in 13 states, and they did 109 beef samples, which in bird flu was only found in one of them. But this is like a drop in the bucket. They also made a recommendation that dairy workers, some 200,000 of them, should take the regular flu vaccine. Now, the regular flu vaccine does nothing to protect you from avian flu. There's a separate vaccine for that. But the reason they were saying, oh, take the regular flu vaccine is because if the regular flu combines with the avian flu and it ends up being contagious so that people-to-people transmission can occur, that's what everybody is afraid of. So far, avian flu is not spread person to person. There's 13 farm workers have gotten it, but they got it from either the poultry or the cattle. So this is just a problem waiting to explode. And there's been very severe criticism against USDA and CDC in their response. Now, behind the scenes, there's a lot going on. So the US government has infused $176 million to Moderna to develop vaccines specifically for avian flu. And just this week, they announced another company, CSL Seqirus, a company in Raleigh, North Carolina, to produce millions of doses of a cell-based avian flu vaccine to up to 4.8 million doses. So behind the scenes, things are going good, but on the ground, not so good. Basically, very haphazard and not very thorough. At least they're going to be looking at beef that's going into the market. Now, typically, just because they find viral particles doesn't mean the beef is infectious. All right. But it just means those cows have it. And you just don't want this avian flu thing mixing with the regular flu, because that is a time bomb. We really want to avoid that as much as possible. But it's good to know this is a step in the right direction. And the warehouse of vaccines, warehouses are full of these avian flu vaccines now. So if as soon as that first case or two of avian flu gets documented person to person, I think the US will be, and other countries as well, will be ready to jump in with an effective vaccine early in any kind of change in the epidemic.
Yeah, and like you said, it's really been a drop in the bucket of monitoring thus far that we know of. So thank you very much for not letting my excitement about the deli meats skip over the avian flu, because we definitely need to discuss.
They're both bad, but
yes,
let's put them into perspective.
Both bad, and both need to be talked about. People need to know about these things. But on that note, thank you very much, Dr. Murphy, for your time, your expertise, answering our viewers' questions, and breaking down the latest headlines for us. It is much appreciated.
Thank you, Katie.
And thank you all for joining us for another episode of the Ask Dr. Murphy series. We hope to see you back next week. And as always, if you have any questions or suggested topics you would like to see Dr. Murphy get into and discuss, please leave them down below or at any of our social media linked in the description. Have an excellent weekend.
Have a great weekend.